Hello everybody! Welcome to our presentation. The article we've chosen as a group is called The Effect of Apicapine and Atacapine upon Levodopa Pharmacokinetics during 3 daily Levodopa administrations. This article discusses the pharmacology of Parkinson's disease.
Parkinson's disease is the second most common degenerative disease that is affecting over 9 million individuals around the world. It is an incurable chronic movement disorder that affects motor features in an individual. It causes low levels of dopaminergic neurons in the substantia nigra, which results in dyskinesia and tremors. Parkinson's disease treatment is more focused on handling, managing, and improving symptoms, when in fact the use of drugs could be a better option. Parkinson's disease affects patients' quality of life by making socialization extremely difficult. This could lead to financial hardships. Example, having medical expenses. Over decades of clinical research, dopamine precursor levodopa was the most effective treatment for Parkinson's disease. Although when levodopa is combined with a COMT inhibitor, it reduces peripheral metabolism of levodopa. The article is chosen because it highlights another potential COMT inhibitor, opicapone, as a drug that could be used in adjunct to levodopa.
The study assessed the pharmacokinetic profile of levodopa driven by inhibition of COMT following either recurrent doses of entacapone or opicapone concomitantly throughout a day. The clinical experiment was conducted in 4 groups of 20 healthy participants, 10 males and 10 females at the SGS Astor Center. Throughout the experiment, 4 participants in each group were given a placebo. 16 participants in one group received placebo once daily for 11 days, followed by 200 milligrams of entacapone with each levodopa-carbidopa dosage on day 12. The other 16 participants in each of the 3 groups received 25, 50, or 75 milligrams of opicapone respectively, once daily for 11 days, with placebo added on day 12 with each levodopa-carbidopa dosage. Blood samples were taken to assess the pharmacokinetics of levodopa as well as COMT activity on day 12.
The study revealed 3 major findings, most prominently that opicapone increases the levodopa trough levels, extent of exposure, and gives a prolonged half-life when compared to entacapone. Secondly, the tolerability profile of opicapone and entacapone was favourable and comparable. Lastly, 75 milligrams of opicapone did not provide an advantage in COMT inhibition. All these findings imply that opicapone at dosages of 25 milligrams and 50 milligrams will increase levodopa availability, resulting in a better treatment option for patients with Parkinson's. It was also found that even with a levodopa-carbidopa regimen of 3 times daily at 5-hour intervals, the prolonged half-life and reduced clearance of levodopa with any opicapone dose resulted in a minimum 2.5-fold increase of levodopa trough levels. Researchers discovered that 75 milligrams may not provide an advantageous effect at all. However, they revealed that both 25 milligrams and 50 milligram doses of opicapone as adjunct therapy will have a significant enhancement on levodopa's availability, providing a more efficacious treatment option for patients with Parkinson's disease.
In relation to pharmacology too, the article discusses the most common drugs to treat Parkinson's disease, such as levodopa and carbidopa, as well as exploring the nature of its corresponding COMT inhibitors, such as opicapine and atacapine. As discussed during the lecture on Parkinson's disease, levodopa combined with carbidopa inhibits dopamine decarboxylase, and in addition with COMT inhibitors such as opicapine and atacapine, it inhibits 3-O-methodopa, which prolongs the time that levodopa is available to the brain. The study above aims to address that there is an effective treatment for Parkinson's disease by using 25 milligrams of opicapine or 50 milligrams of opicapine combined with levodopa and carbidopa. In conclusion, it has been revealed that opicapine, a third-generation COMT inhibitor, offered a greater response upon levodopa bioavailability, earning its favorable tolerability, and it has a long-lasting and sustained COMT inhibition, which leads up to offering to improve patients' quality of life with Parkinson's disease.